O kurde.
Welcome everybody. That's a pleasure to be here with you. Maybe you cannot see me, but probably this is not the most important thing. Probably the things that I'm going to say, they're going to hit you a bit, and I think so that you will remember them from this lecture. So what I prepared for you. Basically, I would like to present the PNF approach. I don't know if some of you are familiar with this approach, or maybe you use it because it's world famous.
Could you just put a bit of light? Sorry, please. Just a bit of light.
I mean, it doesn't bother me, so.
A little bit of light.
Alright, that's perfect, I would say. So my name is Andrzej, but you can call me Andrew. I'm from Poland, I'm a physiotherapist. And I'm a... Yes, I'm also from Poland.
All Andrews are from Poland.
I think so, here.
Even the water.
All in this room, they are from Poland. And I'm a PNF therapist, international PNF therapist. So I would like to show you some more about PNF itself. So the first question, why I would like to give this lecture and why do I like PNF basically? That gives me a lot of ideas for the treatment. The tools, and I can use these tools for any kind of problem solving. We've got different kind of patients. I'm not saying that PNF is only, for example, for the neuro patients or only for the orthopedic patients. We can combine, we can use this approach for many kinds of patients. Basically, that's just the way, how do we think, how we can increase, for example, the performance of the patient. And what else? Why do I like PNF? It uses the functional tests. We can make the functional simple test just to compare the before the therapy and right after the therapy, the outcome. It defines patterns with planes. It says a lot about the motor learning. It's a science basically. It's improved the quality of movement. I really like this part, the gait facilitation, because PNF is really much concerned about the gait, all phases according to the Professor Perry model. We can use PNF also for the muscle tone, and what I like is there's a lot about the planning of the therapy. So what I would like to show, so basically the lecture is a part with the presentation, and I would like to show you some short video. Actually, I've got a few videos just to give you some impression, because what I'm saying, maybe first of all you can imagine the movement, and the movement is the most important part of the PNF because it's the active movement. So PNF basically promotes the all kind of cooperation with the patient, but with the active movement. Yes. So I would like to present you some mat work with the patient. Actually, both of them are instructors, or the PNF instructors, and then a bit about the gait. So the gait application. So this is the mat work, and here they are going to show the rolling. Of course, the purpose of the rolling might be different. We can strengthen the core, which is also the key point in the PNF as the most important part. And so like you can see, basically PNF therapists, they use a lot of input from their hands because it's the manual therapy. And we can give a lot of information through our hands. So if the PNF therapists, they try to master their skills with the hands, they can give much more information for the patient, and the patient, they might understand even more. So like you can see, one of the instructors is showing to the patient how to turn on the side, and he is using different parts of the bodies. It looks simple, but all of these movements are basically patterns, the PNF patterns, that I'm going to say something more later on. And they follow the basic principles, and the treatment follows also the philosophy. So like you can see, he was using the leg just for turning on the side. Maybe the problem was that he didn't know how to do it, and using his strong part, which was a leg in this purpose, he was able to perform this in a nice way. Here he is just showing modalities of turning on the side, and basically they are trying to achieve the upright standing position from the very beginning from the supine, because we can say that this is also a ladder. It's not like this that you have to do it every time with the patient. This is just a proposition of the performance of the of the treatment. Right now we can see some combination of pelvis and scapula patterns, and what is important, we can superimpose the techniques, because PNF itself, this is a movement and this is defined as a patterns, so this is one thing, so we're supposed to master this, and then we can superimpose the techniques over the patterns. Right now this is the presentation how to get to the upright position from prone on elbows. So probably with some of our patients, like let's say spinal cord injury patient or the stroke patient, which I really like to work with, because basically I'm more oriented on the neurorehabilitation. I would try to do part of this treatment within one session, but basically this is an idea to do what we can do as a treatment plan. But of course, we're supposed to do the treatment plan and planning of the therapy accordingly to the patient and his needs, their needs. So here you can see quite fast the whole progression, and I hope so that some of this movement they will give you some idea, like even you can use it today or maybe tomorrow or after tomorrow, why not? Or maybe it will just give you some ideas. Is it really worth to do? But I believe it's really worth just to read a bit and go through some, even a website, just to gain some more knowledge. But of course, the knowledge is only one part of the PNF. The biggest part of the knowledge is basically the hand skills and the performance of the therapies, and the way how does he evaluate the patient. So here we can see the quadruped position. We might have here a lot of reasons why he is doing this. Maybe he's just strengthening the right side of the trunk. Maybe he was trying to coordinate it more. Actually, this whole procedure is quite fast, just to show more of the movements, more of the possibilities, treatment possibilities. This is not the treatment. This is just the sample of the movements. So this is the mat work, a part of the mat work, and I would like to show you some more also about the gait. So just to let you know, he is still trying to get the patient up to the upright position. So
what is he doing actually? He's leading the patient, or he's giving resistance, or what is the idea?
Yeah, it depends actually. That's always the answer, because he's using his hands. He might guide him. He might give him an approximation that will make him stronger, the patient stronger. He might give him an idea where to direct the movement, which is important. He must show him the proper quality of the movement as well. So basically there are many purposes, and later on I'm going to show you the information, like what is the goal of the treatment and what kind of techniques we can use. I know that we got like about 45 minutes, so of course it's not enough just to explain everything, but I think just to give you an idea what is he doing is quite good. What is maybe very important to say here, like he is trying to gain the upright position, and all the time when he is getting the better position, he is trying to stabilize the position. So then the patient, he will know that this position is proper position, and he knows how to maintain the position. So he is using one of the techniques, which is stabilizing reversals. So then the patient, he is staying basically in the same position, and he is trying to resist the resistance of the therapist. Alright, so probably after a while they will stand up. Okay. Let me show you. Just want to give you an impression also regarding the gait therapy, the gait treatment. In a PNF thinking, even that we are talking about gait, walking and standing, we might start the therapy from the very beginning, like even from supine position, sideline position, because anyway it fits to the proper movement, to proper stability of the trunk as well. So this application is in standing. and basically the therapist is using his hand to give to show the direction of the movement. Because when the patient is, when he is alone and he wants to perform the movement, of course he can do it, but maybe not in the best way. And the hands of the therapist, they might just show him the proper position, the better quality of the movement. Yes?
Just I'd like to ask, where is the PNF in this one? Just as I know the PNF.
When?
Where is the PNF? Just this only just is showing the direction.
Uh-huh.
Yeah. Where is the PNF in this one?
Uh-huh. That's a good question. That's a very good question.
For me, isn't it?
Uh-huh. So you're saying, are you asking about the hand placement, for example, or the?
What I know about the PNF is represented neuromuscular facilitation, which you use some muscle group to facilitate the others. Okay. Usually we use approximately distal or whatever that's supposed to be as it was, approximately distal. And this one, which kind of PNF we use? Just as I saw from now, this one we are using the direction of the movement. We didn't see any facilitation.
So right here with the gate, this is all of them I would say are facilitation, but maybe let's go back to the first example when he was.
I mean, this one is the
this one. Okay, so for example, when he is using when the instructor is using his hands, he is giving information. For example, how to do the dorsiflexion or plantar flexion as well, how to maintain the position, and he might give the resistance, for example. Then the patient's core will get more stability. Right now, right here, they are showing more the model of clary. So this part how the PNF is concerned when it goes about the gait. If I would start with the treatment, for example, I would just start in sitting with the pelvis movement, just to gain the good tilt of the pelvis, and then I would try, for example, to stabilize the trunk as well. So actually, we might have a lot of ways how to gain the proper way of gait. Is that an answer or?
I'm not much convinced actually.
I'll continue. Okay. This is just a part. So let me go with the rest of the presentation. That was actually just a fast glimpse of the movement. All right. So I'd like to show you the PNF approach, PNF in practice, and PNF as an educational concept. Just quick information about the history. Everything started in 1940s. In the 40s, the development of the approach has been done by Dr. Herman Krevat in California. And during this time, the epidemic of polymyositis was going on. During this time, so they were able to have a lot of patients with muscle problems. In 1947, Margaret North, who was a physiotherapist, she joined the team, and she gave a lot of physiotherapy ideas, how to connect facilitation of all kinds of activities of daily living with this what Herman Krevat has done before. And from early 50s, there was a program in California for PNF therapies. Even right now, they are able to go there and make the residency program. From 60s to 2000, basically that was the development of PNF courses and the whole approach as a motor learning science and development of the amount of the instructors. And from 2000, IPNF, which is the International PNF Association, and has been grown. So the organization which is organizing these courses as well, and motor learning activities, they were just studied for these people. What I would like to say is PNF, by some people, is known as only three-dimensional patterns and stretch techniques. And of course this is true, but this is not the whole truth, because PNF is something different. This is also a philosophy that possesses the basic principles, techniques, I'm going to show a few of them, and the patterns. So sometimes when people they think about the PNF, they basically think just about to stretch to elongate the muscle itself as a treatment for the problem like decreased range of motion of the joint. So PNF has physiological aspects. I would like to be focused on one, which is for me the most important, and maybe that's why it makes people a little bit confused why it's the stretching therapy. So we have also the stimuli from we get a stretch stimuli, which activates the muscle spindles, gives a facilitation of movement, increased response of weak muscles, increased proprioception and sensation. And often the therapies during the therapy use the initial stretch in a pattern just to show the proper pattern. And going back to the topic about the philosophy of the PNF concept, it says that everyone has potential, so basically we have to look for this potential. There's a positive approach which says about the positive assessment, starts with an activity with this kind of activity that patient can perform, and basically the therapy is supposed to set up the patient for the success, even that he is maybe not very strong. We can use the indirect treatment we're trying to work without pain. Then the specific goal-oriented approach, so the treatment is on the level of structures and activities like functional activities, goal-oriented assessment and treatment, and optimized function level of patients. So that's also a part. Other part of philosophy is using stronger parts of the body. Also mobilize reserves, like we need the active patient participation, intensive training, repetition of variation, and of course here we can say about different positions like we've seen, and different environment, because this is also a part of the important therapy. And we have to consider the patient as a whole person, so to think about that as a whole. And basic principles about PNF. So we've got few like you see. All of them, they're supposed to be done in the same time if we want to have the best results and the best performance. So we can use our hands for the good tactile stimulation. We can use the verbal stimulation just to let patients know what to do, when to do. Visual stimulation also increase the performance. Resistance from the therapist's hands. Stretch reflex, stretch stimulus, for example, to show the movement, the pattern, to initiate. Approximation, which is approximation of the joints to make, for example, the joints more stable and get better idea of the position. We can use also traction. We can use irradiation, timing of the movement, summation of stimulus, and body mechanics. And these are all basic principles, or a few of them I would like to show you on one of the videos. And the video is regards the upper extremity pattern. So let me just show you one of the patterns, which is extension, avduction, and external rotation. Let's go through the pattern, and then I will explain when we do and what we can do. That's also one of many patterns of the upper extremities. Position of the patient is important with this treatment, the table treatment, and then like you can see I just wind up the whole pattern, so take off the whole pattern, and I gave a stretch. Let's maybe go with the same movie but a little bit slower. So I hand placement, that's a tactile input, which is a part of the basic principle. Verbal stimulus, so my command before and right after the performing the pattern. Then visual stimulus when the patient she was just looking and the arm to perform the correct pattern. On the beginning we've got traction. In this situation I'm just showing that I was in the bad position, that was my wrong position. This is also a body mechanics part of the basic principle. So when we are not in a good position we cannot perform well. And maybe patient he won't be able to perform also a good pattern. Quick stretch, which was a tactile again. And this is just a movement so far. I mean, this is the pattern, but this is just a movement. This is actually without any technique. Regarding the techniques, there are many PNF techniques, they are quite known, but I would like to say something more about the techniques, dividing them into the goals and technique itself, because basically when we do any kind of treatment, we just try to focus on our goals, and our goals are, like, of course you know, the improving joint stability, for example, to teach the movement, to initiate the movement, enhance muscle and tendon flexibility. These are all things that we have that we face every day with our patients. And basically for all of these goals we can use the techniques, like rhythmic initiation, for example, we can use to initiate the movement. We can use to teach the movement itself when the patient is not able to perform the movement, or maybe he doesn't feel it well, he doesn't have a good sensation. Then stabilizing reversal, I mentioned about this technique during the video presentation. The instructor was using the stabilizing reversal to improve the stability. In this example, it might be, for example, the joint stability, but also the trunk stability. Replication, we can use this technique as well, for example, for strengthening. Combination of isotonics, very good technique for coordination. Dynamic reversals, that's also good for coordination, but quite well for endurance of the muscle itself. Repeated initial stretch, so when we want to give the patient an idea when to start to try to move in a proper pattern. Repeated stretch for the range of motion. About this technique I will say also something more, but this is a good technique when the patient is losing the idea in which movement he's supposed to go, in which direction he's supposed to go. Hold, relax, contract, relax, timing for emphasis, and rhythmic stabilization are also other techniques. And going back to the replication, the definition is an agonistic technique for replacing a position independently after the static contraction. The goal is to regain and hold the position. So, for example, to know the position as well, to show where is the end of the movement or where is the position that we would like to achieve. And the procedure, how to perform the position. So position the patient in the desired position, actively or passively. Keep position against static resistance. Guide passively patient out of the position, and then ask patient to regain it independently. So we're using our resistance to show where is this movement that we want to achieve. Then we relax the patient, and the patient is supposed to show us this movement again against our resistance as well. After each repetition, the passive wave can be changed, and please consider the effect of the force of gravity as a thing that might bother in this movement.
Can you give us example?
Going back to the pattern, the upper extremity patterns like done a while ago. So
This can help with gait training. With gait training.
Yes, of course, because it might show the position that you would like to gain. For example, when somebody is supposed to remain the like upright position, and he is swayed to one side, like right or left. Let's say it's a stroke patient. I'm more thinking about this for some ataxic patient. So we might show where is the end position. We might keep our hands there, and we might ask patient just to push to our hands. And then, for example, he will sway. He's swayed on the side that we would like to have, and it will say that this is the end of the position. So basically, when we are in the position which is proper, then we can perform, for example, a step. It's like preparation. So we can use this technique as a preparation. And so I'm giving the idea, like my resistance to the patient. He's feeling, he sensed the end position, then he relaxes. And then I ask him, please go back to this position.
His swaying movement?
To this place where I want. Yes? So when he uses weight bearing more on the right side, I'm saying all the time, like, you are strong on the left side, but maybe you cannot sense this well. Just please go on the left side. Yes. So I'm just placing my hands on the pelvis, and he's supposed to understand this movement. He's supposed to remember this position. And we can just try to.
How you will resist this now? How you will resist?
So how will I resist? I will give the gentle resistance. It's not about just to strengthen. It's more like to direct the way of movement.
Okay, so you direct him like this.
It's
right?
not my movement. I'm just asking to push to my hands, and he is pressing against me.
Okay.
Yeah. So when he is touching to my part of the body on my hands, he knows that this is this part of the movement of the sway of the position that I would like to see with him.
So it's tactile stimulation.
Yes, this is typical tactile stimulation, of course. This is the hand placement. So with the tactile stimulation, we also have to consider where to put our hands. Like we're supposed to put our hands on this part of muscle that is supposed to work.
So when the patient is going to push on your hand, that is going to act like resistance?
Yes, yes. Basically, yes. So for example, when it goes about the gait, there is a lot of about the pelvis of the tilt. So basically, you would like also to keep the good posterior tilt of the pelvis, because, for example, it will make the patient stronger with this position. It will give him more information where he's supposed to be. And when he will be well set up, his biomechanics will help him basically to perform, for example, the step, the next phase of the gait. So this is the example of the pattern. In this way, this is one of the trans pattern, which is oblique. And unfortunately, this is not a video, so we cannot see how to make a movement. But please imagine that this is a proper position that I want to see the patient here, and I'm resisting a little bit the patient, making a turning movement, like if I would like to rotate his trunk. This is not a big force, but I'm asking him just to maintain this position. So this is, for example, just to give an idea where is the proper position, but of course we can use this pattern for strengthening of the trunk. Other proposition, the lifting pattern, so this is a combined pattern. In this movement I would like, let's say I would like to have a good, nice upright posture. But he is still slouching, so I'm trying to get the position with the hands so high as possible. I'm giving him approximation as well with this technique as a replication. And then I just correct him basically. Like, can you feel that this is a proper position? Can you feel that you are trying to maintain the good position itself? Next, combination of isotonics. So I've chosen few techniques only due to the time that we have. A combination of isotonics, agonistic technique in which the agonistic muscle chain, they work concentrically, eccentrically, and statically in sequence. What is important without the relaxation. A goal is to improve intra and intermuscular coordination, strengthening, increasing endurance, functional training in order to deal with gravity. And the procedure is dynamic, concentric, eccentric, and static contraction become combined without relaxation again, while we are changing the movement. The technique can be applied in all sections of the path, like of the pattern of the movement. The change of the contraction types is done without grip changes. So again, the important thing, how do we position ourselves as a therapist? just to be even comfortable, and how to keep our hands on the patient, so the hand placement. And the eccentric muscle work can be only done after the concentric or static contraction. And here in this sample we get a mass flexion movement, which is basically shortening the left side of the trunk. The next one, next pattern, which is quadratus lumborum.
Understand how to do this.
I mean, I would like to show you, to be honest, frankly saying how to do it, but I think that we don't have time so much, because this is a very practical thing. Basically, PNF is a very practical thing, so that's why I'm saying that I would like to show you some movies, even like you see, even that the picture doesn't give you an idea on how to do it exactly, but hopefully it will trick you somehow, like to dig maybe books or internet or some other resources.
We might do it like a workshop in the future or something.
Yeah, why not? About the course, one of the hospitals in the UAE, they had already a course, IPNFA course with the IPNFA instructor. So they are done with, I will show you later on some few information, because I got also pictures from that course. Okay. And repeated stretch through the range of motion. So this is the agonistic technique. Stretch impulse applied to muscle under tension or contraction, and the goal is facilitation of the movement to increase, for example, the strength, recruits as much as possible of motor units, and the procedure is active moving in the desired pattern. When the patient contraction forces decreases, a new stretch is given into the tense muscle chain. So going back to this, what I said maybe 10 minutes ago, that when patient is performing the movement and he's losing the idea in which way it will go, or he's losing the strength, or he doesn't feel it, sense the proper movement, then we can just basically go into the movement, try to re-stretch. So the stretch this way, in this way it will be a like stretch stimulus. So it will initiate maybe, I mean it's supposed to be done in a proper way, and then it will show the proper movement, like going back to the pattern of the movement. And the intention of the pattern remains a concentric movement. So the patient is trying to do a movement which is concentric, but maybe he will lose, for example, this concentric work, and giving a re-stretch, we can go back to the track. So for example, here my patient, he was trying to do the bridging, so he was bridging, and we perform also the upper extremity pattern to increase the strength of the core. Actually, to be honest, when you are looking at the picture, we might guess only few things, and like for example, I would say with this patient, I was trying to lean over to one side, to his in this certain situation, the left side, and I was using the irradiation of the stronger part of the body, which is the upper extremity this side, to get more weight bearing on the left side. And because he lost the way how to make the proper pattern, then I just gave him the wrist stretch. So either I showed him wrong pattern, or he didn't feel it, but basically he was also tired. So maybe that was one of the reasons. But we can use the repeated stretch through the range of motion exactly for the situation when somebody is getting tired, just to finish the proper protocol. And let's go to the PNF in practice. So basically these are the patterns, activities with superimposed patterns, so we can do activities of daily living. Like there was a question about the gait, so basically that's a very simple movement, but we might say that was of course the pattern as well. And we can use patterns for neurological and orthopedic patients composed to a perfect treatment program. And let me show you the just one thing that I would like to say is, actually I put this slide a bit further, but maybe that's a good slide for right now. So, how does the PNF and therapy is planned? And we can say about the evaluation, identifying a problem, pretest, warm-up exercises start from the easier and position and stronger part of the body. But basically, what I would like to say is we can perform patterns in different ways. Like we can stay in different positions as well. So normally, as far as I know, some people they consider PNF only as therapy of patterns on the table. But of course, we can do these patterns also in different positions, like in standing, in sitting. All of them they are available. Okay.
Do you have any video on patients?
No, unfortunately I don't have. I mean, I have just one for the gait, but this is not a video like how we perform
the first one which you showed. The pelvis and the shoulder. Like that for the patient, do you have any hemiplegia or some neurological problems?
I mean, unfortunately I don't have any videos because I didn't get a consent. That's why I showed you this, just to give you the basic information. So let's see some more of pattern work. This time for the lower extremity, and I would like to show them actually the same plane, but three different in three different ways. So this is the typical table treatment. I was showing here the pattern for the students. Like you can see here, we've got all basic principles, and actually the pattern is almost the same. There's just one difference, that in the first pattern there was a straight knee. Here we've got the knee is bent. But basically the whole movement is almost the same. It's not like this that you have to progress from this pattern to other one. Of course you can do it, but it's not the rule, but you have to do it in a very strict way. So going back here, we can facilitate here the extension of the knee, but in the, for example, terminal position. So, I was trying to follow all basic principles to perform these all patterns. The next one. So you can see the pre-stretch, and the body mechanics, let's say, is quite easy to recognize. So, all movements that we do the patterns, they're supposed to have some function in life. So let's say this one is like stepping sideways if you want to go for the obstacles. Very simple, but it works a lot with the abductors of the hip. So we can use this pattern as well just to improve the stance phase, for example, when there's some drop of the hip. This is more advanced movement, let's say for the athletes. So we go from the extreme range of motion to extreme range of motion. Saying about patterns, there are well-defined three-dimensional movements. We've got patterns of extremities, neck, pelvis, scapula, and we've got combination of patterns, which are the trunk patterns, like reciprocal patterns, chopping patterns, lifting, oblique patterns, rolling, lower trunk flexion, lower trunk extension. And patterns basically they go along with activities, of course, and superimposed techniques. And during the performance of the pattern, we would like to have the best response and the proper repetition of the pattern. Patterns are named accordingly to the end of the pattern. So these patterns that I showed you, the names were from the end bench of the motion of the pattern. And patterns are defined by the length, the strength test, and landmarks. So how to find and how to know that this is a proper pattern, that we are in the good group. And patterns, they come from lengthened to shortened positions. We've got additional, of course, unilateral patterns. So mostly these, as you've seen, they were unilateral, and bilateral, like lifting, for example. And we can say about symmetrical, asymmetrical, and reciprocal patterns as well. So, like I said at the beginning, PNF requires active movement, and common patient conditions that we meet and we can use PNF, for example, is for the orthopedic patients like diminished core stability or strength, diminished peripheral joint stability, or joint contractures, range of motion limitations. And with the other patients, like neurological patients, we can use this for the muscle tonal disturbance to work with the coordination, to work toward the ataxic patient. So again, how does the PNF treatment is planned? We might say about two things again, that we can divide this treatment like self-care, resisted mat exercises, gait exercises, table treatment. All of them, they might be considered only on, for example, one goal. We might also work with the bulbar function, like swallowing, for example, or breathing, chewing, and family training is also a part of the therapy as it is a functional therapy. So, according to the time, we can perform so much PNF as we want with the patient. But let's say I try to do like 40 minutes, and this time I just divide into the evaluation of the patient, like fast checkup, and then identify a problem. I always try to do a pre-test, which will tell me afterwards as a post-test if I've done a proper treatment. Basically, exercises, I start with the warm-up exercises. I start from the easier exercises to the global exercises, bigger movements, with the stronger parts. Of course, when we perform treatment, we're supposed to go into the point, and I try always to fit the next movement from the other one, which fits into the problem. We have to think also about to relaxate the patient as well. It's not like this that when we set up our mind just to go with one goal, we have to work only toward this direction, because basically we can just tire the patient. So then we have to think about relaxation, like performing opposite movement. And the end of the session is working in a function which will carry over the outcome hopefully for the and after all, I do also a post-test which will tell me if the patient, for example, walks better, or if he is moving his hand better, or if he sits better. This is one of the plans for the therapy. So if we've got a time, I can talk right now. Do we have time? All right. And how much? Oh. So just let me show you a video of one of the patients. Probably, of course, you can identify his problems.
Co to jest za pociąg?
This is the live video, and just please have a look at the patient. How does he? I mean, this is not the patient. This is a normal person on the street. How does he walk? And basically all of his problems. So the hyperextension of the knee, the pelvis tilt, the way how does he sways, the way how does he use his trunk for the rotation. We might basically work. We might basically work using the PNF, and I would like to show the findings. So, for example, we've seen the weak right hip flexors, weaker abdomen from the right side, poor hip flexors. It means the poor knee flexors in this situation as well. Compensation with trunk for the mass pattern, like side flexion. One side was shorter, one side had a better eccentric work. So toward these all findings, basically we can work using the patterns, using the techniques. And the PNF gait follows the PNF Professor Paris modulus of gait from Rancho Los Amigos, and we can work with the positions like supine sitting, sideline, quadruped kneeling, and standing to improve gait, walking, or progress toward these positions. And practical gait sequence might be the wheelchair activities, preparation in sitting, balancing sitting, practical gait, sit to stand, a double with support, and even one leg standing. It depends just from the patient. Here we've got some information about the facilitation of the press swing, so one of the phases of gait. And basically step forward, we might use facilitation of stance like with approximation and resistance. So we had a question about this. So again here the question is if there is a sufficient trunk stability, if there is a good alignment, and of course we have to assess if the pressing is really achieved. We can use step forward, we can use step backward. Basically all movements we can use as a therapy, just depends if we are using the proper principle. Gait style is also beneficial for the patient. Let's say, again, this is the same patient with swaying on the one side, so this is his position, which here in this situation is, let's say, proper. To gain this position, I use a replication. And right now, he was weight bearing on the left side, and we're progressing to the left side. And actually, almost the last thing, so PNF education itself. So PNF as a treatment is divided into courses, and these courses they are divided into 5 courses. I don't know how it's possible actually. I mean, I've been here a year. That's maybe the information that I haven't said. I was curious, like, why the PNF is not so much known here, why there are not any courses going on, basically. But like you see, we've got certain group of courses, the PNF level 1 and level 2. Both of these are the basic course, which takes together 2 weeks. And then we've got the third course, which the participant is supposed to wait from 1 to 6 months between, just to gather some practical skills, and then of course they proceed with the other courses. And this course is PNF level 1 and PNF 2, so the basic course has completed in one of the hospitals here in the UAE, and that was Alain Hospital in February. One of the German instructors, he came and he just gave this whole course according to the International PNFA Association. So basically that was a coursework. So they went through all parts of treatment regarding the basic course. And my references, so this is a book, the script of the courses that I've done, and one of the scripts also from California. Actually, that's all. Thank you. And I would like just to say that PNF is also the people need fun. So hopefully you as a people, you as a friend of the therapists, of the patients, you might just make them more fun during your life. Okay, thank you. Give me a second. The question about the static basis. Uh-huh.